As pediatricians know, swaddling can help soothe a baby to sleep when done safely, but there are important things to communicate with new parents about swaddle products and safety. Here's an example of a conversation you can have when you are counseling a parent about avoiding unsafe sleep practices. So, Olive is doing great. Everything measures well on her exam today. Let's talk a little bit about your concerns. How are things going with sleep?
Olive has a really strong startle reflex that's constantly waking her up. My sister suggested I buy a weighted swaddle to see if that would help. She said it would provide like a gentle pressure that would make Olive feel safe and comfortable.
Okay, so great. Let's talk about swaddling. So important things to know about swaddling. You want to do it correctly. For a baby with a very strong startle or moro reflex, you want to make sure those arms are tucked in firmly so she can't lift them up when she has that reaction. You'll suppress it. It'll help keep her from waking up, and you'll still sleep a little bit better with that. You want to make sure, though, that the hips are nice and loose so we don't have any developmental problems with the hip joint. We want to make sure when you're swaddling that we don't overbundle the baby because overheating is associated with SIDS. And then also very importantly is when to stop swaddling. And when Olive starts to try to roll over, that's the time you need to stop because you don't want her to roll and get stuck in that face down position with her arms trapped. Now, as for the weighted swaddles, we don't recommend them. We don't want anything weighted on top of the baby's chest because the chest cartilage is very soft and it's deformable. We don't want anything weighting down against the baby's breathing. We want them to be able to breathe comfortably. And as far as some of the claims that these companies make about improving sleep, there's really no data to support that. So if you just do your normal swaddling properly, you should get the response that you're looking for in terms of having less startle and better sleep.
I just don't know what to do. She gets so fussy every time I put her down. I don't know how to keep her calm. I just thought it would provide comfort.
Okay, great. Let's talk about that. That can be really frustrating when you have a baby that doesn't settle easily. But there are lots of good tools that you can use. I'm going to share them with you, and I'll also send you with some papers so that you'll have that information. So swaddling is great. It's a great way to calm a fussy baby. Another thing is using a pacifier. Now your breastfeeding is well established. You can give her a pacifier for what we call non-nutritive sucking, and babies really calm down with that. Another thing you can do is you can gently rock her. So that little gentle motion is something that babies really calm down to. They also really like white noise. So shushing is very helpful. And most people don't do that right. They do it really softly, but you want a nice loud shh kind of continuous noise, and babies respond very, very nicely to that. The last thing you can do is a side carry as well. And you never put a baby down to sleep on their side, but sometimes babies with a rocking and a side carry can help if they're a little bit gassy, can help with that discomfort and decrease some of their fussiness. Other things you can do are infant massage. Everybody loves a massage and comes down, and babies are no different. So that's a really great technique to calm down a fussy baby. And another thing you can do is change the environment. If it's been really busy and noisy in your house all day, turn the lights down, take the noise down, make it quiet so that she can relax. She may be overstimulated. Other times, it may be too quiet in the house and there's some boredom. So getting outside and moving around and just having a change in environment can really help with a fussy baby. The last most important thing I want to tell you is make sure you have a backup plan. So if you're having a bad day and she's really fussy, we don't want any parent ever shaking their baby. That can be very damaging and even cause death. So make sure you have somebody you can talk to, somebody you can call or come help you. And if worse comes to worse, you can put the baby down in a safe place. If she's fed, dry, clean, and take a break for a few minutes. Don't leave the house, but just take a break and recharge yourself for a few minutes. That can make all the difference when you pick her up again. And she may even self-soothe herself to sleep.
I know other moms will use a home monitor that will alert when their baby is in danger. Is that something that I could use?
Yeah, so home monitors are not something that's necessary to use, and some people choose to use them if they can afford them because they can be pretty pricey. I mean, if you're worried about SIDS risk, there are no studies that show a benefit to using home monitors. So in that regard, they're not necessary. You don't need them. But, some of our parents are just very cautious and they're worried. If you are not going to be able to sleep at night and having to stare at your baby all the time, then a home monitor can be a beneficial thing. If a monitor going off and startling you at night is going to scare you, then it may not be a good thing to have. And then the question is, when it goes off and there's a problem, or you think there's a problem, how are you going to respond to that? You're going to be calling the office, running to the emergency department, when it may just be a case of a loose lead or the monitor's not picking up accurately. So those are all things to take into account when you're making a decision about the use of a monitor.
Okay, thank you so much. I really appreciate all the information.
Oh, it's my pleasure, and it was great to see you and Olive today, and we'll see you back in a couple months. But if there are any problems between now and then, you give us a call.
I will, thank you.
Pediatricians should acknowledge and validate parents' concerns and help them think about ways to address them. Recommendations for safe sleep should be emphasized in a non-judgmental way to foster a positive and trusting relationship.